opportunity to get out of their seats, put their hands together, give a standing ovation.
Hi everyone, how are you? Good. Good. Well, I'm very excited to be speaking for the first time doing a full class with my name on the picture. Very exciting. In Toronto, which is near my office, so that's great. My team's here and lots of my partner family, so that's wonderful. So today what we're talking about is fertility and chiropractic, helping make babies, and my kids are here too, helping make babies the chiropractic way. What I want to talk about today is we're going to discuss terminology. Some of it you're going to say, why do I have to know this medical terminology? You need to know it if you're going to be dealing with patients that are dealing with infertility, because that is the way they will talk to you. And if you say you specialize in fertility, you better know what they're talking about. We're going to talk also about chiropractic and how what you do is actually going to boost fertility. We will also talk about nutrition and supplementation. We're going to talk about the different things that I add to my history and my treatment plans for my infertility patients. And then we'll talk also about the emotional aspect and the stress that's involved with couples and individuals going through fertility issues. So first, a little bit about me. I have always had a desire to work with patients who are either thinking they might have fertility issues or actually have some infertility. I started that, I've been in practice for almost 10 years. I'm in my 10th year of practice. And 5 years ago, I was able to actually gain a lot more knowledge because I was a surrogate for my sister. What that gave me, the knowledge I got from that was, what is it like when you walk in a fertility clinic? I was blessed with 2 children without having to have any assistance, and that was wonderful and great. So this one now allows me to empathize and understand the huge amount of stress that's involved. Also, what do some of the procedures feel like? Guess what, as a surrogate, you get to go through a lot of them. What do some of the medications do to you? I don't love taking medications. Guess what? You get to take some of them. So at the very top, that's right before I went, a nice joint team effort to get the embryos transferred into me with my husband and I, my sister and my brother-in-law. There's my belly with my sister's fingers, hands around it. There we are, minutes after my niece was born, the whole team that was involved. It was a beautiful, wonderful experience. The very bottom, my kids meeting my niece for the first time with my sister-in-law, holding my niece. And then that's me holding Addison when she was just a day old. And right in the middle, that is what you get to be part of when you're dealing with infertility patients. That's my niece and my sister and my brother-in-law. So what is infertility? Unsuccessful conception after 12 months of unprotected intercourse for women under the age of 35. When you become 36, all of a sudden it goes down to 6 months. But what I want you to know, this is really important, normal fertility is actually the ability to naturally conceive within 2 years of trying. So just because someone comes to you and says, I've been trying for a year, I haven't conceived, I'm starting to talk to my medical doctors, does not mean they're abnormal. And that's a really important distinction that you share with them, and it makes them feel a lot better. 1 in 6 couples in Canada experience infertility. It's actually greater in the US, just because there's more people. Top 2 reasons for female infertility are tubal factors, which is endometriosis, blockage of the tubes, and ovulatory disorders where they're either not ovulating or they're not producing follicles or eggs. Statistically, 20%, this is a typo, so it's not unexplained fertility, it's unexplained infertility, but 20% of cases are unexplained infertility. 50% of infertility is female alone, so female issues, what I just talked about. 30% of infertility is male alone, so that's when there's usually an issue with the sperm. So either there are no sperm, the sperm don't know which way to swim, they have issues as far as DNA fragmentation, agglutination, which means they stick together and they never come apart, so a big clump of sperm doesn't fertilize an egg. Now in 1995, a number of people suffering from secondary infertility, and that is when you've had no issues having your first child, conceiving your first child, but all of a sudden you go to have your second child and it's not working. And it was estimated to be 1.8 million people. In 2006, it had already gone up to 3.3 million people. So you can only imagine how quickly it's growing at this point. Costs. Costs are a huge factor when you're dealing with patients who are suffering from infertility. It affects so much of their life because this is a major decision. Up to $6,000 per cycle for medication alone. In Canada and Ontario, we have OHIP, which is Ontario additional benefits the government pays. $250 for semen analysis. That actually has gone up to about $450. $2,500 to $7,000 for just the medication, and $5,000 for IVF. That is one transfer. If you were lucky enough to produce more eggs than that and more embryos, then you have to pay for costs for them to store it. They freeze them and store them. IUI, which is intrauterine insemination, what a lot of us would refer to as artificial insemination, costs approximately $450, in addition to the cost of the medication, which is anywhere between $27,000 and $2,500, and that's per cycle. Egg donor costs approximately $28,000 to $35,000, and that includes one transfer. So it's a lot of cost and a huge investment for individuals. Terminology. Follicle. That is actually the structure in the ovaries that contains a developing egg. They look through with ultrasound. You can't see the egg, so they count the number of follicles. Embryo is an egg that has been fertilized by a sperm and undergone one or more divisions, which is the picture at the top. A fetus is unborn offspring from the 8th week of conception to the moment of birth. I make no judgment or say anything about what your personal beliefs are. This is the definition, and this is what most of your patients will be going by when they're talking about a fetus. IUI, intrauterine insemination, catheter through the cervix, and they send the sperm right into the uterus, and then the sperm have to swim their way to find the egg. IVF, in vitro fertilization, very similar, except they actually take an embryo, so one of the pictures above, and they put that, 1, 2, maybe 3, and then put it into the uterus and hope that it implants. And ICSI, intracytoplasmic sperm injection. This is often used if there's not a lot of eggs that have been retrieved, if the sperm aren't good swimmers, so they don't want to try and take a risk with natural fertilization, and they take a single sperm and they actually inject it directly into the egg, which is fertilizing it, and they just hope that it will start multiplying. Medications. The reason I talk about this as well is so you know some of the words, because clomazine citrate, seraphine, clomid. How many of you have heard these names before? They're all the same. I've had patients come in and say, I'm on seraphine, and others come in and say, I'm on clomid. And until I knew, I was like, okay, are these different? Are these exactly the same? And what they do is an oral medication that blocks the estrogen receptors in the hypothalamus and pituitary gland, so your body starts producing more FSH and LH, follicular stimulating hormone and luteinizing hormone, and therefore you're going to produce more eggs. Letrozole Femera, this is the new happier drugs that they like to pick because, very similar, but it tends to clear the system faster and it doesn't affect the uterine lining or the cervical mucus to the same degree. A lot of women who've been on Clomid for a while, the lining of the uterus becomes thinner, makes it much decreased chance of implantation. Injectables. So this is going by stage. They start usually with the oral medication, then they go to injectables. They're more costly and more invasive. FSH and LH, go on the left, and Puragon are the main ones that get used a lot, and they're looking for the same reactions. They're trying to produce more follicles and eggs. In HCG, the main ones they use is Ovidril, or actually HCG, which is forcing ovulation. So they'll give the injection to the woman, and then 48 hours later, they'll either retrieve the eggs if it's for IVF, or they'll go and try and have intercourse if you're trying to conceive naturally, but this is to help with when they think it's actually ovulatory issues. And Lupron. This is actually what they give to a lot of women who have cancer and they're trying to suppress the entire system. So this is what they call a long protocol. If you have patients that come in, Lupron suppresses the pituitary gland, basically shuts your whole system down, and a lot of times they'll also put you on a birth control pill, and then they take you off, and then they hyperstimulate you, hoping that you'll have a better reaction. Fertility testing procedures. If you have a patient, I have a lot of patients that come in and say, I'm not even trying to conceive, I haven't done anything. The first thing that I often recommend, if they have had nothing done but they've been trying to conceive for a while, is just a blood test. You want to get a blood test done between day 2 and day 5. They'll test for FSH, LH, estradiol, testosterone, prolactin. It's a lot of tubes, I know. DHEA, T3, T4, TSH, and free testosterone. And then repeat on day 21, and they'll check your progesterone levels again. And what they're looking for is to see, it gives you an idea if you've ovulated. Is this going to give you all the information you need? No. In Ontario, I can't order the blood work myself, but this is just something, it also gives patients an idea of what they can go and ask for, and also gives them a little more control over the situation. AMH. This is something a lot of individuals don't know about. A great test if they're looking at doing IVF, looking at going to the next stage, or they're older and they're really concerned about their ovarian reserve. This the number gives you an idea of how many eggs or follicles you probably have left. As women, we have only a certain amount. We're born with it, and that's all we have. So this gives us an idea. If women have issues with ovarian reserve, they are not good candidates for IVF because they're not going to produce enough follicles for it to warrant how much it's going to cost. Sono HSG, I was lucky to have this test. Awesome. Not really. It's not too bad. It's a thin catheter through the cervix, and they send saline into your uterus, and then they send little bubbles that go up through your fallopian tubes to see if you have any blockage or to see if you have any abnormalities of the uterus. That's the first step. And they do this through ultrasound as well. The HSG, same test, but they send dye. So it gives you a better idea of what's going on inside the uterus. And they'll use this often if there's been repeated miscarriage. Hysteroscopy, again, the next stage that they will often do is a small telescope-like viewing device, so a little camera so they can actually have eyes in there and see if there's anything that is being missed. And then the last stage will be surgery, laparoscopy, where they inflate the abdomen and actually are looking in. The only benefit to this is while they're in there, if you're having this done, they might as well see if they can clean things out. Do I necessarily think that all of these tests are absolutely necessary? No, but that is something that this is the progression of what happens in a fertility clinic once you've entered that room. Semen analysis. The reason I want to talk about this is one of the least invasive things that can be done, and the number of women that I have coming into my clinic who have gone through a lot of those other tests and their partner has never had a semen analysis, it's shocking. So what they look for, semen analysis, the male gives a deposit, and they look for motility, morphology, a DNA fragmentation, agglutination where it sticks together, mobility, quality, quantity, as well as direction of movement. And they will know very quickly. The great thing if there is a sperm issue, it's so easy to help for most cases. Anti-sperm antibody test. This is another test that can be done to see if your body's producing antibodies to actually fight or kill off the sperm. There's no way a sperm can fertilize an egg if you're killing it off. And genetic testing. So now let's get to some of the good stuff, talking about how chiropractic and subluxation will affect your fertility. C1, blood supply to the sympathetic nervous system and the pituitary gland. Why is this important? Well, the pituitary gland actually releases FSH, which stimulates your ovaries to allow about 20 follicles, which they call antral follicles if you're looking at it through an ultrasound, on the surface of the ovary to grow. Well, guess what? LH is also produced by the pituitary, and that's the luteinizing hormone. That is critical for the second half of the cycle for ovulation. So if you don't have enough of that, you're not going to release an egg. And production of sperm. They produce, males, 5,000 sperm cells every minute. There's a lot of jokes that go along with that we are going to skip over. But it's under the control of FSH and LH. Males also have that, so we need to be looking at that, C1. C7, thyroid gland. One of the #1 cause of unexplained infertility is thyroid issues. Hypothyroidism can prevent ovulation. It will elevate levels of prolactin, which will also affect ovulation. Can create shorter luteal phase, which is the second half of a female cycle. And that will affect also the chance of implantation because it won't necessarily have a thick enough lining. If you have too short of a second half of your phase, you're not going to thicken your lining, you're not going to be able to, the embryo will be able to implant. Hyperthyroidism can also prevent ovulation and it can cause infertility. And thyroid issues, there's an increased chance of miscarriage or fetal death. T9, adrenals. How many of us have adrenal fatigue? Maybe. Couple. So the cortex of the adrenals assists the testes and the ovaries by producing sex hormones and the master hormone DHEA. And that's a steroid hormone and precursor to estrogen, progesterone, testosterone. Sorry, my dog's taking pictures of it. So do you think those are critical not just to fertility, but actually all of our overall health, our hormonal health? Huge. DHEA levels are low, and that will affect your endocrine function as well. T12, what I want you to notice, C7, T12, transition zones. Those are really important. Don't we see a lot of subluxations in transition zones? T12, fallopian tubes and lymph circulation. We need our fallopian tubes as females to be functioning the best they possibly can. Lymph circulation, lymph system plays a key role in chronic inflammation, decreased sex hormone binding globulin, and decreased immunity. Do you think this could affect your fertility? Yes. When I have a patient that comes in, they don't fill out a different history form. One, I don't want them to be pointed out as, oh, ding, 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 it's a fertility patient. They don't have a special little red folder. So they fill out a chiropractic history form. We have a detailed history that we take on these fertility patients. What I ask when I'm in there taking their history, a lot more discussion on lifestyle. We talk about smoking, drinking, jobs, stress, diet, supplements and vitamins that they actually take on a regular basis. Digestive issues. Excess yeast, huge issue with fertility. Traumas, frequency of intercourse. Yes, we will be talking about sex. Discussion of fertility history. How long you've been trying, what you've tried, who they've seen. You need to know where they're at as far as in the stage of trying to get pregnant. And if they're in infancy or if they actually have been to see many doctors so you can support them the best that you can. A chiropractic exam for detection of subluxation. I actually do a normal chiropractic exam. There's nothing different for these patients. Evaluation of posture. Really important. What did I say about C7? What if they're walking around like this? Do you think that could have an impact? So discussion of posture. Evaluation of posture for males. Really important because we don't want them to be crossing their legs all the time if they have a low sperm count. We don't need anything to be increasing the temperature. So you have to look at things like that. I use a subluxation station at my clinic, so the NSFI testing from CLA or similar type of testing. So thermal scaling, so I do thermography, I do SEMG. And x-rays, but I only ask patients to get x-rays if the female's within the first 10 days of her cycle and the male is not actively trying to conceive for 48 to 72 hours after the time of it, around the time of having the x-ray taken. If these patients are concerned about getting x-rays taken, wait and see if that cycle didn't work. Don't make them second guess themselves because the last thing you need when you're playing emotions with infertility patients, the last thing you need is to be questioning if something they did actually created so they did not conceive. Research. We're going to I'm going to cover a few articles as far as the research. If you want more information, there's a ton. Just email me. My email will be at the end, and I will share more of that research with you. A lot of them are case studies. So here's the first one. This is from 2003. It's a female infertility and chiropractic wellness care. It's a case study on the autonomic nervous system response while under subluxation-based chiropractic care and subsequent fertility. There was a marked improvement in autonomic and motor function, and that was demonstrated on the SEMG and thermography. And she became pregnant 9 months after commencing chiropractic care. That's pretty awesome. This other one was a 37-year-old woman. She had a history of endometriosis, a retroverted uterus, which means a tilted uterus, inactive ovaries, and she wasn't able to conceive. She had 4 unsuccessful attempts at in vitro fertilization. Medically was discovered after she'd been under care that her ovaries were showing activity, and this was based on ultrasound because she was at a fertility clinic for the first time on her record. And she produced 2 mature eggs, and she was pregnant and gave birth to a healthy baby girl. The only thing she did differently in this study was she began chiropractic care.
Where was this last one?
The last one was Journal of Clinical Chiropractic Pediatrics.
I'm sorry.
Oh, that's okay. This one, it doesn't make a lot of sense if you're not familiar with the numbers, but what it shows is this 34-year-old woman, she had an aborted IVF, which means either it was a chemical pregnancy, so she seemed pregnant, but there was not a fetus or an embryo that showed up on ultrasound. And on her second IVF, after she had started chiropractic care, her hormonal levels were responding the way they were supposed to. The oocyte, which is the egg retrieval, it showed that they were able to get 10 eggs, and each approximately 18 millimeters. I'm just going to take this opportunity to let you know, a mature egg is anywhere between 18 millimeters and 23 millimeters, or they'll say 1.8 and 2.3. So that's the range that you'll hear people talk about. They successfully aspirated the eggs, which is how they collect the eggs with a needle, and a successful pregnancy and plus issue anymore. I see a lot of women that are 22, 24, 27 in my practice all the time. So she suffered 2 miscarriages and had been anovulatory, which means not fertilizing, not ovulating at all, for 9 months. After 60 days of chiropractic care, a normal ovulatory cycle occurred and she became pregnant after a second normal cycle. That's incredibly powerful. I also want you to notice that I'm not discussing technique whatsoever. It does not matter what technique you are using to help these individuals, as long as you are helping remove subluxation so their body is functioning properly. Now we're getting to the fun part. Yes, Brandy, this is for you. Let's talk about sex. If you are dealing with patients who are suffering from fertility issues or infertility, you need to be comfortable discussing sex. So we're going to do some myths versus facts. You need to stand on your head or keep your legs up in the air for 20 to 30 minutes after intercourse. How many of you have heard this from patients or done it yourself? I have not. No? Okay. So, true and false, mainly false. You do not need to do this. This is not going to increase your success rate dramatically. The only time the female might want to have her legs up is if the sperm really are slow swimmers, if the motility is not there. But honestly, the amount of stress that this creates, because can you imagine, okay, great, get out of my way, put my legs up, it's not really good. It's not very nice. Now the next one, quantity is better than quality for intercourse. Bit of both, and we'll talk about the quality in a second, but the quantity is better because you actually need to have intercourse enough to actually conceive. I have had couples that come in and say, we have been trying for 8 months and we haven't gotten pregnant. How often do you have intercourse? We have intercourse at least twice a month. Wow. Okay, we need to talk about frequency. That's not going to cut it because, yes, are there stories where, seriously, it was one time and that was it and I got pregnant? Yes, but you're just lucky enough. So that is not the case for most people. So you need to make sure that your patients are having intercourse enough that they even have a shot of conceiving. Only have intercourse around the time of ovulation. False. That is not the case. Those little ovulatory kits are sometimes right, but usually within 40 to 72 hours, and even then, not always accurate. I've had women that tested them out, so they were getting cycle monitoring done at a fertility clinic where they go in almost every day and have ultrasound done and blood work done to see where they're at in their cycle. And the ovulatory stick never showed up that they were ovulating, and the ultrasound showed that they released an egg. So you have to take that into account. Fertility problems begin at 35. Fertility problems begin at 20. Our fertility as females start decreasing at 20. Males, it's a little bit later. So don't think, oh my gosh, I'm 34 and I'm going to be 35 and that magic, as soon as my birthday happens, I'm going to have issues. It's not the case. There's young individuals. I have patients that are 43 and have their first baby and didn't have to try. So it doesn't matter, it really depends on the person's body. Daily sex helps conception. Yes and no. If you are game, daily sex, I say go for it. If you don't conceive after 2-3 months, you might want to alter your plan. Every other day is much better. 1, you will be exhausted. Every other day gives you the chance for the sperm to regenerate so they're as potent as possible when you're trying to conceive. But it's from day 8 to day 18, sometimes to day 21. So that's a lot. When you have patients, I will share a little story. Kids, cover your ears. Share a little story. I've had patients, and once they are comfortable with you, they will share stories when you've been trying every other day for 8 months, for 10 months. I don't care how much you love your spouse or your partner, that's a lot. So there are sometimes discussions that they will share with you because they can't share with their partner of, do you think it's wrong to ask if I actually have to take all my clothes off? Or do you think it's wrong to say, can you just get started and I'll come in at the end? These are actually thoughts that go through their head. So you have to have some humor about it and also be understanding what they're going through. And so if they have a month where they decide, I don't want to try it often, it's okay. Conception occurs the day of intercourse. No. Conception occurs when the egg is actually fertilized. So that 40 to 72 hours, if not a little bit longer. Stress causes infertility, absolutely. Is it the only cause of infertility? No, but it is a big factor. What I don't want you to do, one of the worst things you can do as a friend, let alone as a practitioner, is say, go on vacation. You just need to relax. And you'll get pregnant. It's not a worry. Do you think they have a lot of that? Pretty sure they have. So that is not usually good advice, and they get very angry about that. So I would avoid that one. Sperm survive and floccate for 48 to 72 hours. They do. Female sperm actually survive longer than male sperm. I don't recommend trying to plan having a girl by timing it that way, but they do last a little bit longer. But that is why the every other day is okay, because even if you ovulate in between, the sperm are still there. This last one, saliva can have an impact on sperm health. Yes, it can. So what I would say about that is, if you are actively trying to conceive, avoid how much saliva is involved during that time. And we'll just leave it at that. So getting back to the quality. This is an interesting hypothesis. It's called the upset hypothesis. It is two British biologists, Robin and Mark Ellis, and they investigated this upset hypothesis. It is discovered that when a woman climaxes, any time between a minute before to 45 minutes after her partner ejaculates, she retains significantly more sperm than she does after non-orgasmic sex. I don't recommend you give this advice when the couple are in together. I usually just talk to the female patient alone and I say, it doesn't matter when it happens, who's involved for this part to happen, but I highly recommend that you try and ensure that you are able to find a way to climax some point within 45 minutes of it happening. Again, if they've been trying for a long time, the last thing the male needs to think is, oh my gosh, there's something else I have to be doing and I'm not doing it right. But it's true. The other thing is it's shown, the research showed that when the woman has an orgasm, her uterus actually contracts. The reason that's important is it actually creates almost like a partial vacuum and it sucks more from the vagina to the cervix and therefore gets them closer in a better position to reach the egg. So it helps with motility as well. Treatments. Explain how chiropractic will be helpful in improving overall health and allow the nervous system to function optimally. Another thing I want to mention about this is I believe in supplementation. I believe that the body can heal itself. These patients aren't necessarily going to be able to only hear about that. This is true, but you also have to honor the fact that they want to know, how will this get me a baby? That is what they're focused on. So I educate, I talk about chiropractic, I talk about the health of the nervous system, but I also honor the fact that sometimes they can only hear little bits of that. So you have to honor where they're at. Discuss how position and alignment of the pelvis could have an impact on their fertility. If the pelvis is tilted, is shifted, that has an impact on the uterus. We have to look at those things, educate your patients so they have an understanding. Regular chiropractic adjustments and treatment of care. I create a treatment of care for chiropractic just like I would for any other patient. You don't have to look at where they are in the cycle. The only thing I recommend, if your patient is going to a fertility clinic and they are looking at, so they're it's called ART, Assisted Reproductive Technologies, that's fertility clinic world. If they're on medication where they're trying to produce more follicles, it's very sore if they have grapefruits for ovaries to lay on their tummy. So if they're at that point, find different ways to adjust them so they can still be getting adjusted, but they're not having to be uncomfortable while it's happening. I also do acupuncture for some of my patients, and we'll talk about that after. That is something that I do move around depending on their cycle. So that is different. Supplement and diet recommendations. This is really important for your fertility patients. I don't care if you don't want to do supplementation or are not comfortable, that's fine. Associate yourself with someone in your community, a nutritionist, a homeopath, a naturopath, whoever it is that would be able to give them the advice so you guys can work as a team. What we like to say is there's a wellness team in our community. Lifestyle modification recommendations. You need to make sure that you're looking at all of those things as well. And additional therapies. So nutrition and fertility. Don't worry, I'm not going to cover all of this, but we're going to look at aspects of it. This was a affects your fertility. And they also noticed that women who take a multivitamin long term are 40% less likely to have ovulatory infertility than women who don't. For vitamins, there's vitamin C. Really important. I'm not going to cover all of this like I said, but if you want more of this information, feel free to email me. It's important in sperm production. Keeps sperm from clumping together. It actually makes them more motile and improves sperm count. The one thing I want to mention is males who decrease dietary vitamin C from 250 milligrams to 5 milligrams a day showed a 91% increase in the number of sperm with damaged DNA. That's huge. Vitamin E, need for balanced hormone production, and it's also called the sex vitamin. So it's really important. It also helps sperm fertilize eggs. Vitamin A for glandular, reproductive gland function. B5. B6 is great for synthesis of RNA and DNA. It also helps the body metabolize excess estrogen, progesterone, and produce adequate progesterone, and lowers the elevated levels of prolactin. So it's really important to help with that balance. B12 is very important for sperm count. Selenium, zinc. Zinc is one of the ones that I like to recommend a lot. It's involved in virtually every aspect of male reproduction. Helps testosterone, sperm formation, motility. If the males or anyone is on zinc for a long time, what I recommend is 1 milligram of copper for every 10 milligrams of zinc, for a total of 3 milligrams to prevent copper deficiency. Manganese, arginine, L-carnitine. These are all critical for all aspects of our overall health, as well as for fertility. So what I'm going to get to is these vitamins. I give a list with explanations for vitamins for males and females, and I say, take this home and read it. Don't go buy a thing. Come back and we'll talk about what's best for you. So for males, if they only want to take a couple, because males are not great at taking supplements, zinc and vitamin C are two of the big ones for them, and really helps make a huge impact. For females, chaste tree berry, I'm going to talk about that in a second, but that's one of the most important things that I recommend, even for women who have abnormal cycles. So it's great for balancing out their cycle and making it a more regular cycle. Folic acid, most women trying to conceive are already on it, but I love a B12 folic sublingual. They tend to absorb it better. Other supplements for hormonal issues are donquay, red clover, licorice, wild yam. For relaxation, there's valerian and skullcap. And yarrow is also great when there's infection that's involved. Now, chaste tree berry has been shown to be very effective, but chaste tree mixed with vitamin C, even better. So a combination of chaste tree berry and vitamin C, 750 milligrams a day, was shown to help 25% of women with the luteal phase. Remember, that's the second half. Defect become pregnant compared to only 11% who didn't take the vitamin C. Male infertility tips, tighty whities. No more. Hot tub, saunas, excessive vigorous exercise. I was mentioning crossing the legs. We need to make sure that you decrease overheating of the testes. Candida, heavy metals, plastics, pesticides. A lot of times with my fertility patients, I'll recommend that the males get a hair analysis done. If you don't do that, naturopaths do it. It's great. They can get feedback as far as what's going on. You can change a male's sperm in 74 days is usually the life cycle. So you can do a lot for them within 74 days and see drastic changes. This is just a fun tip. I like to share this with patients because you need to have some humor. This is a sniff test. I'm not sure how they came up with this, but what I was looking at has smells and how men's penises reacted to them. So this is going to boost the sale of scented candles, I would say. But pumpkin pie combined with donuts increased blood flow by 20%. Pumpkin pie with lavender, 40%. And even buttered popcorn by 9%. So this is a true test. So the psyche of the fertility patient. The reason this is so important is because you need to honor and respect that aspect of your patients. It's stressful. It's horrible. And a lot of times they haven't told anyone about it, so it's very lonely. Understand their goals, understand their timelines, know where they're at. If they want to try for just a couple minutes, then she gave you minutes, for a couple months, and then they want to jump right into fertility clinics, that's okay, that is their right, and so you need to know what the timelines are and give them the best advice that you can. So I put together a video just to give you a bit of an idea about the emotional aspect that is fertility, and most of the comments are actually from my patients. Can you just start that for me? Thank you. They have different versions.
I will show you love like you've never loved before. I will go the distance, back for more if you just say the word. 'Cause you will come alive again. All the try and tend your friend, pain that you have suffered through, never get the best of you. You will hope in something good, won't depend on how you feel. When you call my name, then I will answer, answer, 'cause I am on your side. Though the wind and waves beat against your face, and you were on my mind when the world was made. Trust in me, my child, trust in me, my child. Walk out on the water, you have no control. Scared to death of failure, sacrifice your soul, please let that go. 'Cause you have climbed an uphill road, you have worn a heavy load, you have cried through endless nights, nearly given up the fight. Watched your dreams like falling stars, heartache made you who you are. But looking back, you see that I have always been there. 'Cause I am on your side. Though the wind and waves beat against your face, and you were on my mind when the world was made. Trust in me, my child, trust in me, my child. Where you gonna hide? Where you gonna hide from me? Where you gonna go? Where you gonna go that I can't see? 'Cause I have heard you cry, and it breaks my heart, for I love you so. I will never lie. This is not the end. There is still a hope. And I am on your side. Though the wind and waves beat against your face, and you were on my mind when the world was made. Trust in me, my child. Trust in me, my child.
So that just gives you an idea of, I hope that video gave you an idea of how emotional and stressful that can be. But I also want you to recognize how important what we do and how we can help our patients through this journey. So you want to remember the importance of the chiropractic adjustment and listen to their history and plan. Listen to them. Don't always try and inject your view and your belief system on them. Remember I said, they have laser beam focus on their one goal right now, and we know how much we are doing for them is really just to help their body function properly, but they can't always hear that at that point. Diet, nutrition, its role, remember that. Remember those critical supplements. Here's some of the wonderful little babies that I've been part of their journey towards becoming who they are now. I like a little copy and paste at the bottom. So what I want you to recognize is you too can also be a small piece, and you already are, but if you want to venture into helping more patients and more individuals who are dealing with infertility, look at these things, and I recommend that you do because it is so rewarding, and I love it. And then you also then have these wonderful chiropractic babies who have been under chiropractic care before they were conceived. And so I hope that gave you some information. If you want any more, I have